So I'm here to talk today about the principles of surgical asepsis. And these principles apply anytime you're going to do any kind of a sterile procedure. There is not one way to do procedures, but as long as you follow the principles, you will be fine. A sterile object only remains sterile when touched by another sterile object. So for example, with my dressing tray that's considered sterile, I can't put my hands on anything because they're not gloved with sterile gloves. I need to use my forceps, only touching the outer ends, and then use my forceps to ensure I am keeping things sterile in my sterile field. Only sterile objects can be placed on a sterile field. So for example, when you're doing a dressing change, everything that's going to be on your dressing tray needs to be sterile. I can't take my normal saline bottle and set it down on my tray, for example. Everything on this tray, my forceps, my bandages, all need to be kept sterile. Anything on the sterile field that gets out of my range of vision or is below my waist is considered contaminated. And how this applies is I cannot turn my back on my sterile field. I can't walk away from my open sterile tray, and I need to make sure that my dressing tray is opened and positioned waist level. Anything below that would be considered contaminated. But a sterile field or object becomes contaminated after prolonged exposure to air. Usually about 15-20 minutes or so, if you've had your sterile field open for that period of time, you can start to consider the possibility that it's becoming contaminated. And at that point, you have to make a decision about whether you're going to open a new sterile tray or you're able to continue with the one you have. The other principle that this impacts is that we don't want to reach over top or have any movement or flow of air over top of our sterile field. We want to avoid talking, coughing, laughing over top of the sterile field if at all possible. When a sterile surface comes in contact with moisture, that area that has been moistened is considered contaminated. If you spill a few tiny drops on your dressing tray, just avoid that area with your sterile bandages. Otherwise, you will have to change your dressing tray. Fluid flows in the direction of gravity, and how that applies when you're doing a sterile dressing is that we advise you to keep your tips of your forceps pointing downward and work with your sterile field pointing downward rather than having forceps held upward and the fluid flowing down that way. And lastly, we consider 1 inch around the sterile field to be considered contaminated. And in this example, we've marked it red to give you a visual of the area that would be considered contaminated. And this would be applied with your sterile forceps. The area that my hand is touching the forceps is the area where the forceps will rest.